Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. So today I want to come on and discuss urinary frequency or voiding dysfunctions and how that can be related to VA disability and what happens in a C&P exam or a compensation and pension exam. So many veterans suffer from voiding dysfunction or urinary frequency for a variety of reasons. So urinary frequency is really mostly a symptom of another condition. So something is causing it. So one of the most common things that we see is something called benign prostatic hyperplasia or BPH. Some other reasons why people can have urinary dysfunction are maybe it's a residual of cancer, maybe the veteran had bladder cancer, prostate cancer, or something like that. It can be related to some type of incontinence. You can have a stress incontinence and be causing if you've had multiple babies, if you're a female veteran and you've got stress on your pelvic muscles, maybe you have urinary frequency or difficulty with voiding or voiding dysfunction because of that. You can have nerve-related issues, just caffeine intake. Maybe you drink too much caffeine, right? There are a variety of things that can cause urinary frequency. So a veteran can be service connected for urinary frequency due on a primary basis or on a secondary basis. So if a veteran was diagnosed with urinary frequency for whatever the underlying cause was while on active duty, or perhaps it was after active duty, but there were signs of it and you can prove or show that it was developed or manifested while on active duty, they can be service connected on a primary basis. If it is due to another condition or a secondary service connection, you can get it connected that way as well. So diabetes can cause urinary frequency. Maybe you're on a medication. There are some hypertension medications that cause a person to develop a lot of urinary frequency as well. So let's talk about, before we get into the DBQ itself, let's talk about what happens after the veteran files the claim. So after the veteran files the claim, if VA decides that, hey, there's enough evidence, we're going to send this person to a compensation and pension exam. Or perhaps you might even submit your own private DBQ from your doctor, and they may say that's enough evidence, right, that they can rate your claim. But regardless, if they request a C&P exam, you're going to get a packet in the mail. That packet is going to tell you where to go, who it's going to be with, how long the person's been doing examinations for, probably what type of doctor it is, or if it's a nurse practitioner or a PA. So you're going to show up to that examination and the person there is going to run down a whole list of questions with you that are on something called a DBQ or a Disability Benefits Questionnaire. You can head on over to va.gov and you can download this and take a look at it yourself, but I'm going to pop it up real quick so that we can go over it together. Okay. So let me present this really quick. Okay. Here we go. Okay, so this is the Disability Benefit Questionnaire for urinary tract issues, including bladder and urethra, and it excludes male reproductive system. We've gone over that in other videos, but we're just going to go over this voiding dysfunction today. I'm going to make this a little bit larger for you guys here. Okay, so on the first page, it's going to have the claimant's information, their date of examination. As you can see, it asks, this is for that provider to fill out. Are you completing the DBQ at the request of the veteran claimant or other? Is this person a VA healthcare provider? Because like I said, you can ask your treating provider to fill this out as well if they're not a VA provider, just your regular doctor. Was the veteran examined in person? Yes or no? Evidence review. What did they review? Did they have your VA claims file? Did they just have records that you provided to them? What did they have? Okay. So the diagnosis, so this is the diagnosis section. So the doctor is it asks them, does the veteran currently have, or have they ever been diagnosed with a urinary tract condition of the bladder or urethra? Yes or no. And if it's yes, you're going to go to section 1B here. And then they're going to put what is that diagnosis, right? What is the primary diagnosis? Like some of those diagnoses we talked about earlier. And then the date of diagnosis, okay? Like, did you have a urinary tract infection? Did you have a, cancer of your urethra or your bladder? If there are additional diagnoses, put them down here. That's where they're supposed to put additional diagnosis. They fill all these up. Okay. Medical history. So they want to know the medical history of the condition, a brief summary. So here's that voiding dysfunction section. So does the veteran have a voiding dysfunction, yes or no? And so if the answer is yes, they want them to put what is the etiology or what is the reason that the person has it if it's been worked up, okay? Does it cause urine leakage? So this would be a good thing for you guys to have notes on so that you can, add, you may want to do a journal, like a voiding journal. There's a bunch that you can print off online that let you list how often you went to the bathroom, how much have you drank for the day, things like that. Does the voiding dysfunction cause urine leakage? Yes or no? And if it's a yes, they want to know these specifics, right? Do you have to wear, they don't wear absorbent material? Do they wear some type of absorbent material that they have to change 2 times a day? Whether it's like for ladies, if you're wearing a pad, you may be wearing a diaper or some type of absorbent material to help with that. Does that have to be changed? How many times a day does it have to be changed is basically what they're asking. Does the voiding dysfunction require the use of an appliance? Yes or no? Does it cause increased urinary frequency? Yes or no? And then they're going to ask you if it does cause increased urinary frequency. They want to know how many times a day or like how often during the day. Is it less than, the interval between episodes? Is it less than an hour? Is it 1 to 2 hours? Is it every 2 or 3 hours? How many times at night are you waking up? Okay. Does the voiding dysfunction cause signs and symptoms of obstructed voiding? Yes or no? So a lot of this is related to prostate issues sometimes. So like hesitancy, slow stream, weak stream. Several questions that have to do with urinary retention requiring catheterization. These are for stones. So we're not going to talk about stones today or bladder infections. We're also not talking about, this is for other bladder or urethral conditions. So tumors and neoplasms, this is for cancer related matters. And we can do another video on that at a later date. But again, most of these DBQs can be used for more than one thing. That's why there's several things on here, but it might not apply to you. So we were just going over the urinary frequency today. Then other pertinent physical findings, complications, and conditions. So does the veteran have any other pertinent physical findings, complications, conditions, signs, or symptoms related to any of the conditions listed in the diagnosis section? Do you have any disfigurement of the skin related to any of the conditions? Diagnostic testing. They want to know if you've had diagnostic testing. Have you had cystoscopy? Have you had a CT scan? Have you had anything like that? Functional impact. Does this condition affect the bladder condition affect your ability to work? So if it is affecting you and you've got to be, maybe you work from home or you have some kind of agreement with your boss that you can take X amount of bathroom breaks or something like that. Maybe you've got to sit in long meetings and this affects you in that way. And then the examiner is supposed to sign all of the information, right? So let me stop that. So let's talk about the ratings. So again, I always put this disclaimer out there. I'm not a legal professional. I work with a lot of legal professionals. I enjoy working with a lot of accredited VA attorneys and claims agents, VSOs. If you need help finding one, you can head on over to va.gov and there's a handy tool there for you guys to look and find one in your area or just anywhere nationwide. So the ratings for urinary frequency are always subject to change. So you want to check with a VSO on that. But at 40%, you can be rated at 40%. If you're urinating more than every hour daily or 5 or more times during the night, 20%. If it's every 1 to 2 hours daily or 3 to 4 times at night. 10% is if it's every 2 to 3 hours daily or at least twice at night. Okay, so that's why some of those questions were on that DBQ. So it helps the rater or whoever the adjudicator is understand where you fall into that criteria. So I hope this was helpful. Please drop some comments if you would like to see any more specific videos related to urinary dysfunction or just anything else in general. And as always, thank you for watching and please like and subscribe. Okay, see ya.